My name is Brad Bays. I'm a registered nurse in the Vattikuti Urology Institute at Henry Ford Hospital. Wanted to share some information and some suggestions following your robotic prostatectomy. During your surgery, a nurse will be updating your family periodically to let them know how the surgery is going. Your physician will talk with the family after the surgery is completed. The first thing you'll notice is you will go from the operating room to the recovery room. You'll spend 1 to 2 hours there. After surgery, you will have between 1 and 6 different little incisions that the prostate in the surgery was performed through, and a catheter coming out of your penis called a Foley catheter, which is secured to your leg. Generally, if everything goes well and you're feeling good, we let you go home that evening from the recovery room. If a night in the hospital is necessary, we ask that you have a family member here by 10 a.m. so that we can get the discharge completed by around lunchtime at noon. So you have a Foley catheter that's inserted into the penis, into your bladder, and this drains the urine. You'll notice that there is a little port and a catheter connected to a bag. The little port is a balloon, and that is inflated to keep this from falling out of your bladder. We don't want this to get tugged on too much. It becomes uncomfortable. So to avoid that, we use a little device called a stat lock holder that has a little prep pad that we wipe off an area of your leg about the same size as the device, and we stick that onto the leg. That will give us an anchor point to keep that catheter from getting pulled on where it's inserted into your penis. So we just put the prep pad on, let it dry for a moment. The backing comes off like a Band-Aid, and we stick that onto the leg. You don't have to worry about orientation because a little clip swivels 360. And you'll see when you go home, the catheter clip has a wide side and a narrow side with a little post in the middle, and we have a wide tube and a narrow tube. Catheter goes in and it clips to give us an anchor point. Theoretically, this will stay on until you come back to see us. It comes off where you can reapply it yourself. So when you go to bed at night, you'll be connected to the larger bag, which includes this long, thick tubing. The large bag has a lever at the bottom that we use to empty. It says open and close. That just opens up. It drains out the bottom, and when you're done, you click it closed. The big bag does need to be hung down below the level of your bladder, otherwise gravity will win and it won't drain. During the day, when you're up and about, you'll put a smaller leg bag on that looks just like this. It has a little valve at the bottom that you can pull to open and push back flat to close. A little cap that I refer to as a just-in-case cap that we put on in case this accidentally gets opened. You won't make a big mess. That's completely up to you. The leg bag have 2 Velcro elastic straps that come in the bag, and they're both the same. It doesn't matter which one goes where, but one will go at the top and one will go at the bottom. It just goes in, around, and back through. And the same thing at the bottom. When you change between big bag and little bag or vice versa, Everything happens at this junction right there, and that's just a friction fit. It doesn't screw on or clip on. These ends are tapered, and this catheter is rubber. So you would pinch off behind, push the tube off, put the other bag on, push it till it feels snug. And then we wrap this around the leg. We will have one strap above the knee and one strap ends up being below the knee. And once again, this is Velcro. It doesn't need to be really tight because the support is happening with our little holder on the leg. So we wrap it around. Bottom strap will wrap so that it's a little bit looser since it's below your knee, and when you move around it won't bunch up. So this is what you look like during the day. Every 2 to 4 hours or whenever you notice this is getting to be full, you'd walk to the bathroom, leave this part alone, undo your bottom strap, and just let it drain into the toilet. Shut it off and re-strap it on. So that's the catheter, the Foley catheter, big bag, little bag, and changing back and forth. In addition to the Foley and the incisions, you may find that you feel bloated after surgery. That's very common. And one strategy technique that we employ and ask you to employ are to eat smaller appetizer-sized meals, even at discharge at home for a few days until your bowel function has returned. We do have you take a stool softener to help reduce the chances of constipation. We additionally tend to use non-narcotic medications to help control your pain. These also tend to make you less constipated after surgery. Following discharge, it may be 2 to 3 days before you have a bowel movement. If you're finding that you're uncomfortable, something like Miralax or milk of magnesia, which are over the counter, may help stimulate a bowel movement for you. Passing gas will happen as you continue to move around and stay active. It's not uncommon to have minor pain at the incision sites, some feeling of bloatedness from the gas that we blew up to do the surgery, or a feeling of needing to urinate despite the catheter draining. It's called a bladder spasm, and there are medications that we can use if you're finding you're having that feeling of bladder spasm. Other things we find are some shoulder pain and some swelling that will occur in the scrotum and penis. For the shoulder pain, warm compresses or a massage may help. For the edema, the swelling, rolling up a small towel to elevate when you're sitting, and wearing briefs that give you some support will help reduce that swelling. Prior to discharge, we will make sure you are able to walk and comfortably keep down food. At home, we encourage you to walk frequently every hour or two, not walking long distances, but frequent walks will help you feel better sooner. As mentioned earlier, smaller, more snacky appetizer-sized meals tend to go down easier, and you'll feel better until the bowel function returns. There are some reasons where you should contact us early and not wait. Chest pain, shortness of breath, if you have one-sided leg swelling, these you should go to the emergency room right away. If you're having fevers, chills, nausea, you should give us a call. During the day, You can reach us at 313-916-2062. After 5 p.m., please call the operator at 313-916-3700 and ask for the urology resident on call. We thank you for placing your trust in Henry Ford Vattikuti Urology Institute. Please feel free to call if you have problems or questions.